Hi everyone, welcome back to Vet Scholar, and today we're kicking off our veterinary neurological disease series with one of my absolute favorite topics, epilepsy in dogs. This is a very common condition, and it's something we see often in the veterinary world. In this video, we'll cover the essentials, from the basics of what epilepsy is to its causes, different seizure types, and the phases of a seizure. Before we dive in, please don't forget to support our channel. Like, subscribe, and hit that notification bell so you don't miss out on any future educational content. We'll break this video into the following sections to help you better understand epilepsy. 1. Introduction. 2. Pathogenesis. 3. Types of seizures. 4. Phases of seizures. 5. Conditions that mimic seizures. 6. Causes of seizures and key terminology. 7. Diagnostic workup. We'll wrap up with some factoids worth remembering, so stick around. And be sure to like this video if you find it helpful. Epilepsy is the most common chronic neurological condition in dogs, affecting approximately 0.62% to 0.75% of the canine population. Among these, idiopathic epilepsy, the most common type of epilepsy in dogs, impacts between 0.5% and 5% of pet dogs, though some breeds are more prone than others. Seizures, though alarming and distressing for owners, are often manageable. However, up to 25 to 30% of epileptic dogs do not respond to standard therapies like phenobarbital or bromide, becoming what we call refractory epileptics. An owner might come to us expecting complete seizure control, but only about 15% of dogs achieve full seizure freedom with medication, compared to a much higher 70 to 90% in humans. For most dogs, our goal is to reduce the frequency and severity of seizures. It's important to set realistic expectations with clients, explaining that we aim to balance seizure control with minimal side effects. Epilepsy, by definition, refers to recurrent seizures that occur due to abnormal, excessive electrical activity in the brain. This hyperexcitability is the result of an imbalance between excitatory and inhibitory neuronal mechanisms. In normal brain function, neuronal firing is tightly regulated through a balance of inhibitory neurotransmitters, such as GABA, gamma-aminobutyric acid, and excitatory neurotransmitters, primarily glutamate and aspartate. In epileptic conditions, the excitatory pathways become overactive, while inhibitory controls become ineffective, allowing for uncontrolled firing of neurons. This results in paroxysmal depolarization shifts that manifest clinically as seizures. There are two key processes involved in the worsening of seizures. Kindling. This is a phenomenon in which repeated subthreshold electrical or chemical stimulation eventually leads to the recruitment of more neurons, increasing seizure frequency and intensity. Mirroring. When hyperexcitable neurons in one part of the brain activate their contralateral counterparts, causing seizures to spread across both hemispheres. Idiopathic epilepsy is the most common type seen in veterinary practice. It is thought to be genetic, although the exact mechanisms are still being studied, particularly in breeds predisposed to epilepsy, such as Border Collies, Australian Shepherds, and Beagles. Understanding the pathophysiology is crucial for targeted therapeutic approaches, such as the use of anti-epileptic drugs, or AEDs, aimed at increasing GABAergic activity or reducing glutamate transmission. Seizures are broadly classified into two categories: generalized and focal seizures. Generalized seizures involve bilateral hemispheric brain activity and typically result in loss of consciousness. They typically manifest as tonic-clonic seizures. They are characterized by an initial tonic phase, where the dog exhibits muscle rigidity, often leading to collapse. This is followed by the clonic phase, during which the dog may experience paddling motions, jaw chomping, and rhythmic jerking of limbs. During seizure activity, autonomic discharge may be observed. This may include urination, defecation, and hypersalivation. Focal seizures, on the other hand, arise from a specific localized area of the brain and can occur with or without consciousness impairment. Clinical signs depend on the region of the brain involved. They may present as facial twitching, unilateral limb movements, or behavioral changes like sudden aggression or repetitive actions. Focal seizures can evolve into generalized seizures, a phenomenon known as secondary generalization. Recognizing these differences is key for clinicians in identifying the type of epilepsy and guiding treatment decisions. Let's talk about the phases of seizures. Each seizure can be broken down into distinct phases that help us clinically identify and characterize the seizure event. 1. Prodrome. This can last from minutes to days and is characterized by subtle behavioral changes. The dog may exhibit anxiety, restlessness, or clinginess to the owner. Second aura. Immediately preceding the seizure, this phase may last seconds to minutes and is marked by distinct behavioral signs like whining, pacing, or seeking attention. Third, ictus, the seizure itself. Depending on whether the seizure is generalized or focal, ictus may present with muscle rigidity, paddling, convulsions, or other signs. Fourth, postictal stage. This is the recovery phase following a seizure. It can last from minutes to hours and is characterized by confusion, disorientation, ataxia, or temporary blindness. Some dogs may exhibit transient behavioral changes, such as increased thirst or hunger. It is essential for clinicians to recognize each phase, as they can offer diagnostic clues to the type and severity of the seizure disorder. Several conditions can present similarly to epileptic seizures, but differ in their underlying pathophysiology. It's important to differentiate between true epileptic seizures and these seizure mimics. Syncope. Often misinterpreted as a seizure, syncope results from cardiovascular issues like arrhythmias or vasovagal events, and typically features a short loss of consciousness with rapid recovery, lacking the postictal confusion of true seizures. Vestibular disease. Peripheral vestibular disease can cause dogs to exhibit head tilts, circling, and loss of balance, which can resemble seizure activity. Narcolepsy, cataplexy, sudden onset of sleep or muscle paralysis due to disorders in sleep regulation. Pain, orthopedic disorders. Pain-induced episodes, especially in small breed dogs with luxating patella or spinal issues, can look like focal seizures. When considering the causes of seizures, it's essential to understand several terms used to categorize causes of seizures. Symptomatic epilepsy, which are at times also called structural or secondary epilepsy, are seizures that occur due to an identifiable structural lesion, such as a brain tumor, inflammatory disease, or stroke. These are for the most part intracranial causes. Reactive seizures are seizures caused by extracranial conditions, such as metabolic disorders which include hypoglycemia, hepatic encephalopathy, or toxicities such as lead poisoning. These are largely extracranial in origin. As described before, idiopathic epilepsy refers to recurrent seizures of unknown origin or likely genetic in origin. These are typically diagnosed when no structural abnormalities are found on imaging, and all metabolic causes have been excluded. Another term to familiar with is cluster seizures, which are more than one seizure in a 24-hour period. Status epilepticus, defined as a seizure lasting longer than 5 minutes or multiple seizures occurring without full recovery in between. This is a medical emergency and can lead to permanent brain damage or death if not treated promptly. When a dog presents with seizures, a systematic diagnostic approach is crucial to identify the cause and inform the treatment plan. A thorough history is the cornerstone of diagnosis. Key details include establishing age of onset. For example, idiopathic epilepsy tends to typically manifest between 6 months and 6 years of age. On the flip side, an older patient 10 years and older is more likely to have neoplasia. Other important points include seizure frequency, duration, and any identifiable triggers. Try and establish if there is family history or breed predisposition. Lastly, always ask an owner if they have a video of the event. A comprehensive neurological exam helps identify whether the seizures are focal or generalized and may provide clues to underlying brain pathology. Patients with neurological deficits between seizures have a higher tendency of having a structural brain lesion. Blood work, standard CBC, biochemistry profiles, and urinalysis to rule out metabolic causes. Advanced imaging, MRI or CT scans may be necessary if structural epilepsy is suspected. Cerebrospinal fluid, CSF analysis may also be indicated in cases where inflammatory or infectious diseases are suspected. Lastly, here are some key points from the lecture. That brings us to the end of our deep dive into canine epilepsy. In our next video, we'll explore the treatment options for managing epileptic seizures, including medications like phenobarbital, potassium bromide, and newer options like levetiracetam and zonisamide. Don't forget to like, subscribe, and hit the notification bell to stay updated on our latest videos. Thanks for watching, and I'll see you next time on Vet Scholar.